Good afternoon, students. Today, I'm going to discuss about Unit 7, Unit 8, and as well Unit 9. I'll try to complete Unit 9 also within the time frames. So, Unit 7 is about the illness. So, good morning, all of you again. Now, today we are going to discuss the topic illness, which is an important topic in health psychology. To begin with, we need to understand the difference between health and illness. Health is not merely the absence of disease, but a state of complete physical, mental, and social well being. Illness, on the other hand, refers to the state of imbalance in biological, psychological, and social functioning. So, this unit helps us to understand how individuals perceive illness, how they think about it, and how they cope with it. It also explains how illness is not just a physical condition, but a psychological and social experience as well. The way person interprets illness influences their behavior, emotions, and recovery processes. So, therefore, illness must be understood from the biopsychosocial perspectives. So, next point is the nature of illness. Now, let us understand the nature of illness. Research like Hersling in 1973 studied how people define health and illness. According to her findings, people view health in three main ways: as absence of illness, as a reserve of strength to resist illness, and as a state of balance or equilibrium. This shows that health is not just physical, but also includes psychological and social balance. So, illness can be defined as a condition where this balance is disturbed. When a person becomes ill, several changes occurs. The individual experiences symptoms such as pain, fatigue, or discomfort. The body communicates that something is wrong, and the individual might either accept or deny the illness. So, the person may seek help depending upon the severity of the symptoms. So, illness also affects relationships, daily functioning, and emotional states. Individual may react with anxiety, anger, denial, or shock. So, in law 1995 further explain illness by identifying different dimensions such as not feeling normal, presence of symptoms, and specific illness labels and consequences of illnesses, and timeline and absence of health. These dimensions helped us to understand how people perceive and describe illness in everyday life. So, illness cognitions is like, let us discuss illness cognition, which are the beliefs that perceptions individuals have about their illnesses. These beliefs act as framework that guides how individuals respond to illness and what actions they take. And according to Leventhal, illness recognitions consist of five main components. These are: the first is identity, which refers to the label and symptoms of the illness. The second is a perceived cause, which includes beliefs about the cause and illness. and such as biological or psychological factors. The third is a timeline, which refers to how long the illness is expected to last. And the fourth is the consequences, which includes a perceived effect of the illness on life. And the fifth is curability. Curability means here or controllability, which refers to the belief that whether illness can be cured or managed. These cognitions influence how individuals cope with illnesses. For example, if a person believes that their illness is temporary and controllable, they are more likely to seek treatment and recover. On the other hand, if they believe it is severe and uncontrollable, they may feel helpless and avoid treatment. Self-regulatory model of illness. So now let us understand the self-regulatory model of illness. So this I have covered just now. So self-regulatory model of illnesses, which consist of three main stages, that is interpretation, coping, and appraisal. In the first stage, in the stage one, interpretation, the individual becomes aware of symptoms or receives information from others, such as doctors. They try to understand the illness by assigning meaning based on their beliefs and understand and experiences. This stage involves both cognition and emotional responses. For example, a person experiencing chest pain may interpret it as a serious and feel anxious. And the second stage is coping. Coping. In this stage, the individual takes an action to manage the illnesses. Coping can be of two types: approach coping and avoidance coping. In approach coping, the individual actively deals with the illnesses by seeking medical help and following treatment and maintaining a healthy lifestyle. In avoidance coping, the individual denies the illness and avoids treatment or engages in unhealthy behaviors. In the third stage, this is the appraisal stage. Here, the individual evaluates whether the coping strategies are effective. If the strategies are successful, they continue them. If not, they change their approach. This process continues until the individual feels that balance has been restored. So, Suchman stage of illness behavior. Next point. Another important concept is Suchman's stage of illness behavior, which explains how individuals respond to illness over time. And there are 5 stages in this model. The first stage is symptom experience, whether the individual notices physical symptoms and interprets them. This stage involves physical sensations, cognitive interpretations, and emotional reactions such as fear or anxiety in the individual. And the second stage is assumptions of sick role, whether the individual accepts that they are ill and seeks advice from family or friends. They may reduce their responsibilities and begin self treatment. The third stage is medical care contact, whether the individual seeks professional help from doctors, they look from diagnosis and treatment and may consult multiple doctors if unsatisfied. If the individual is unsatisfied, they'll go to different doctors for the second. In the fourth stage, in the dependent patient role, whether the individual accepts the patient role or follows medical advice, and they depend on doctors and family for recovery of the illness. In the final stage is recovery and rehabilitation, whether the individual gradually returns to normal functioning and gives up the patient role. In some cases, especially chronic conditions, complete recovery may not occur, and the individual learns to adjust to the illness. Psychosocial factors of illnesses, which includes illness is influenced by several psychosocial factors, which include both psychological and social elements. One of the most important factor is stress. So high levels of stress can affect both mental and physical health and increases the risk of illnesses. The stressful situations such as family problems, financial issues, and lack of support can worsen illness perception. So self-esteem and self-concept also plays an important role. Individuals with low self-esteem may feel helpless and may not seek treatment, and they may develop negative thoughts about their health and body. Social relationships are the another important factor. Supportive family and friends help individuals cope better with illnesses, while lack of support can lead to depression and poor recovery. Work conditions also influence health. Stressful work environments, long working hours, and lack of health care facilities can increase illness risk. Personality also affect illness behavior. Type A personality, who are competitive and aggressive, are more prone to stress-related illnesses, while type B personalities are more relaxed and less prone to illnesses. Then the next one is the management of illness. Effective management involves prevention, awareness, and treatment. Early detection through screening helps identify diseases at an early stage and improves chances of recovery. And reducing unhealthy behaviors such as smoking, alcohol use, and poor diet is important. Individuals should be encouraged to adopt healthy lifestyles, including regular exercises, balanced diet, and stress management. Psychosocial interventions are also important here. This includes counseling, education, and support system that helps individual cope with the illnesses. Family and support and medical care plays a crucial role in the recovery. So in conclusion, illness is a complex state influenced by biological, psychological, and social factors. Leventhal's self-regulatory model highlights how individuals interpret, cope with, and appraise their illnesses. Illness cognitions shape a patient's belief about their identity, causes, timeline, consequences, and curability. And psychosocial factors like stress and self-esteem and social relationships, work and personality significantly impact illness perception and recovery. And effective management also involves prevention, early detection, personalized interventions, and comprehensive social and medical support. So, illness is not just a physical condition, but also a complex interaction of biological, social, psychosocial, and social factors. And understanding illness, cognition, behavior, and management helps improve health outcomes and equality of life and quality of life. Therefore, a holistic approach is essential in dealing with the illnesses. So, by this, we have finished Unit 7. Now we are moving to Unit 8. So, Unit 8 is about chronic illness and its impact. So, now we are going to discuss an important topic in health psychology course, chronic illness and its impact. To begin with, let us understand what we mean by chronic illnesses. Chronic illnesses are conditions that are long lasting, often permanent, and rarely completely cured. Unlike acute illnesses, which resolve quickly, chronic conditions require continuous management. Now, think about conditions like diabetes, hypertension, asthma, or heart disease. These are not illnesses that disappear after treatment. Instead, they become a part of person's daily life. Because of this, individuals are often forced to reevaluate their identity, roles, and lifestyles. So it's important to understand that the impact of chronic illnesses is not only physical, it also affects emotional well-being of the person, social relationships, and occupational functioning. And different individuals react differently to chronic illnesses. This variation depends on their personality level, coping skills, social support, and severity of illness. So, chronic illness is not just a medical issue, it is a biopsychosocial condition. Initial reactions to diagnosis. That is, now let us move to the how people react when they are diagnosed with a chronic illness. When a person hears such a diagnosis, it is often unexpected and overwhelming. According to researchers, individuals typically go through a sequence of emotional reactions. First one is a shock. So, in this stage, the person feels stunned, confused, and emotionally numb. Autonomic behavior will be there. For example, imagine a person going for a routine checkup and suddenly being told they have diabetes. The immediate reaction is disbelief. And the second stage is encounter reaction. Here, emotions become intense. That is fear, anger, sadness, helpless, distress, feeling overwhelmed. The person begins to realize the seriousness of the illnesses. And the third stage is retreat. The third stage is retreat or denial. In this phase, the individual may ignore symptoms, refuse treatment, act as if nothing is wrong. Denial can temporarily protect the person emotionally, but it may delay treatment. Finally, we have the adaptation. This is a stage where the person accepts the illnesses, learns to cope with the situation, and adjust lifestyle. It is important to note that these stages are not fixed or linear. People may move back or forth between them. Then the next stage is a coping process in chronic illnesses. Now let us discuss how individuals cope with chronic illnesses. Coping begins with what we call cognitive appraisal. This means the person evaluates what, what the illness means to them and how it will affect their life. Based on this evaluation, they develop coping strategies. According to Moose in 1992, parents must deal with two types of tasks, that is illness-related tasks, that is managing symptoms such as pain or fatigue and adjusting to treatment procedures and building relationship with healthcare professionals and psychosocial task, which includes managing emotions like anxiety or depression and maintaining self-esteem and preserving relationships and preparing for an uncertain future. For example, a person with vision loss may not have physical pain but may struggle socially or professionally. So, coping is influenced by person resilience, social support, environmental factors, and here role of family is also important to support the individual who is suffering with chronic illnesses. Now let us focus on the role of family. Family members plays a crucial role in the adjustment and recovery process. They should provide emotional support to the patient, help in treatment adherence, and encourage independent living. And patients tends to adopt better when families are supportive and avoid overprotection and encourage self-reliance. So, however, chronic illness can also be create stress within the family members. So they will be having financial burden, role changes, and emotional strain can be observed in the family members. For example, if a person becomes physically disabled, other family members may need to take on additional responsibilities. So, does family support can either facilitate recovery or increase stress depending on how it is managed. Coronary heart disease. Next point. Coronary heart disease occurs due to the narrowing of the arteries that supply blood to the heart. This can be lead to chest pain, heart attack. Risk factors include poor lifestyles, that is diet, smoking, and lack of exercise, stress and depression. And psychosocially, coronary heart disease patients often worry about returning to work, physical activity, and future health. Next, going to discuss about the stroke. Stroke occurs when blood flow to the brain is disturbed. Symptoms include weakness on one side of the body, difficulty speaking, blood flow is disturbed, weakness, speech issues, and depression risk. Loss of balance will be there, and psychosocial factors impact the stroke is significant. That is, the depression is common in the patients, and loss of independence and social isolation will be observed in the patients. And recovery can be long and challenging for these patients. And next, we are going to hypertension and diabetes. Hypertension or high blood pressure is often called as a silent disease because it has no clear symptoms. However, it increases the risk of heart disease and stroke as well. Interestingly, research shows that simply being diagnosed with hypertension can cause psychological distress. Now, diabetes. Diabetes occurs when the body cannot regulate blood glucose properly. There are two main types, type 1 diabetes and type 2 diabetes. Type 1 diabetes requires insulin, and type 2 diabetes lifestyle related and more common in the population. And managing diabetes requires strict diet, regular exercise every day, and monitoring blood sugars in the body. And psychosocial challenges, which includes for the diabetic patients, difficulty adhering to treatment, and stress affected blood sugar levels, and conflict between patients and the doctor goals. Next, moving to asthma and allergies. Asthma, which affects breathing and triggered by allergens, stress or exercise. Emotional states like anxiety can worsen these symptoms. Allergies like immune system overreaction, and it can also affect skin, lungs, and digestion. Increasing prevalence worldwide. This is the asthmas. And psychologically, allergies can be lead to anxiety, reduced quality of life, and social limitations. So menstrual disorders like include irregular cycles, MPS, and PMDD. And symptoms include pain, mood swings, and emotional distress. Social and cultural stigma around menstruation can be increased stress will be there in the patients and reduced support. Then the next point is the psychosocial interventions. Managing chronic illness requires a multidisciplinary approach, which includes doctors, psychologists, social workers, and therapists. Common psychosocial intervention include education support, teaching patients about their condition, and social support. Support groups and family involvement should be there, and relaxation techniques like reducing stress, and cognitive behavior therapy, that is a CBT, changing negative thoughts in the patient, and family therapy, improving family dynamics is very essential. Then summary. So chronic illness refers to the long-lasting health conditions that does not resolve easily and rarely completely cured. such as illness requires continuous. Common examples include coronary heart disease, diabetes, asthma, stroke, and hypertension. And chronic illnesses affect not only physical health but also emotional, social, and occupational functioning. And the way individual experiences chronic illnesses depends upon factors such as personality, coping ability, level of social support, and severity of the condition. And when the individuals are diagnosed with chronic illnesses, they usually experience a series of emotional reactions. Initially, they may go through shock when they feel confused, numb, and unable to process the information. This is followed by the encounter reaction characterized by strong emotions such as fear, anger, sadness, and helplessness that we can observe in these kind of chronic illness patients. In the next stage called retreat or denial, individuals may ignore the illness or refuse to accept the diagnosis, and finally they reach the stage of adaptation where they began to accept the illnesses, adjust their lifestyles, and develop coping strategies. And these stages are not fixed and may overlap or vary from person to person. So, the coping process in chronic illnesses began with cognitive appraisal, which refers to how the individual interprets the illness and its impact on their life. So, based on this appraisal, the person develops coping strategies. Coping includes dealing with symptoms, adjusting to treatment procedures, and maintaining a good relationships with the healthcare providers. And the second is a psychosocial task, which involves managing emotions, maintaining self-esteem, preserving relationships, and preparing for an uncertain future. Effective coping is influenced by personal resilience, environmental factors, and essentially social support. So, family plays a crucial role in helping individuals coping with chronic illnesses. Supportive family members provide emotional encouragement, assist the following treatment plans, and promote independence to the patients. And strong family support leads to better adjustment and recovery, while lack of support can increase stress and negatively affect the patient's well-being. So chronic illness can be also be create strain in the family due to financial burden, role changes, and emotional stress in the family members. And coronary heart disease is a common chronic condition caused by narrowing the arteries that supply blood to the heart. It can lead to the chest pain and heart attacks. Risk factors include unhealthy lifestyles habits such as smoking, poor diet, lack of exercise, stress, and depression. So, the psychosocial impact of coronary heart disease includes fear of physical activity, concern about returning to work, and increasing family stress. So, stress stroke is another serious condition that occurs due to the disruption of blood flow to the brain, and it can result in weakness on one side of the body, and speech difficulties will be observed in the patient, and loss of balance is there, and stroke often leads to depression, loss of independence, and social isolation will be there in the patients, and making recovery both physically and emotionally challenging for this kind of stroke patients. So hypertension, next one, that is a high blood pressure, is often called a silent disease because it has no obvious symptoms. So it increases the risk of heart diseases and a stroke. Psychological factors such as stress, anxiety, and even the awareness of being diagnosed can increase emotional distress. So diabetes is a condition characterized by high blood glucose levels due to the problems with insulin. It is a two types, it's of two types, type 1, which requires insulin injection, and type 2, which is more common and related to lifestyle factors. And managing diabetes requires strict adherence to diet, exercise, and medication, which can be psychologically demanding, and stress can also negatively affect blood sugar control. So, next is the asthma, is an inflammatory disease of the airways that causes breathing difficulties, and it can be triggered by allergies, stress, and physical activity. Emotional states such as anxiety and fear can worsen the asthma symptoms. And allergies is a condition where the immune system reacts excessively to substances like dust, pollution, and certain foods. It can affect different parts of the body and may lead to anxiety and reduced quality of life. And menstrual disorders are also common chronic conditions in women, including problems such as irregular cycles, pain, and premenstrual syndrome. These conditions can cause emotional distress, mood swings, and social discomfort, often worsened by cultural stigma and lack of support. And psychosocial interventions plays an important role in helping individuals manage chronic illnesses. And these interventions include educational support to increase awareness, and social support from family and groups, relaxation techniques to reduce stress, cognitive behavior therapy to change negative thought processes, and family therapy to improve relationships. So, a multidisciplinary approach involving doctors, psychologists, and other healthcare professionals is essential for effective management of the chronic illness patients. So, in conclusion, chronic illness significantly affect both physical and psychological well-being of the individual. Successful management depends upon effective coping strategies and strong social support, and appropriate psychosocial interventions. Understanding these aspects help improve the quality of life of the individual and living with chronic conditions. So by this I have covered unit 8 also. Now we are moving to unit 9, that is a terminal illness. So now we will discuss the importance and sensitive topic in health psychology, which is terminal illness. It refers to a condition that is life-threatening and has no cure. So where the focus of treatment shifts from curing the disease to providing comfort and improving the quality of life. Unlike acute or even chronic illnesses, terminal illness involves awareness of approaching death, which makes it psychologically and emotionally complex. And terminal illness does not affect only the patient, it also deeply affects family members, caregivers, and even healthcare professionals. So, the experience of terminal illness includes physical pain, emotional distress, and social changes, and spiritual concern. Therefore, it is best understood using a biopsychosocial approach. So, which consider the interaction of physical, psychological, and social factors. The meaning and nature of terminal illnesses is characterized by limited life expectancy, where medical science cannot provide a cure. Common examples includes advanced stage of cancer, end stage organ failure, and progressive neurological diseases. In such cases, treatment focuses on palliative care, which aims to reduce pain and suffering rather than cure the illness. The nature of terminal illness is unique because it involves anticipation of death. Patients may experience uncertainty about how much time they have left, which can lead to anxiety and fear. The illness may also result in loss of independence, changes in body image, and dependence on others for daily activities. At this stage, the patient often begins to reflect on their lives, relationships, achievements, and unresolved issues. So, this process can lead to both emotional distress and personal growth, depending on how the individual copes. And the next stage is the psychological impact of terminal illnesses. So, here, the psychological impact of terminal illness is profound. One of the most common reaction is fear of death, which may include fear of pain, fear of unknown, and fear of leaving loved ones behind. The patients may also experience anxiety and depression, especially when they feel a loss of control over their life. And another important aspect is the feeling of loss. So patients may feel that they are losing their identity, independence, and future plans. This can lead to sadness, hopelessness, and withdrawal from social interactions. However, not all patients react in the same way. Some individuals may find meaning in their experience and develop a sense of acceptance and peace in their lives. Factors such as personality, cultural beliefs, religious faith, and social support plays an important role in shaping the psychological responses. Then the next point is the awareness of death. An important concept in terminal illness is the awareness of death. Not all patients are fully aware of their condition. Awareness can vary from complete knowledge to partial awareness or even denial. So, the level of awareness depends upon the several factors, which include communication by healthcare professionals, cultural beliefs, and family attitudes. So, in some cultures, families may choose not to disclose the full truth to the patient to protect them from distress. So, awareness of death can influence emotional reactions. Patients who are aware may experience fear and anxiety, but may also have the opportunity to prepare themselves psychologically and emotionally. This preparation can include making decisions, resolving conflicts, and saying goodbye to loved ones. Kubler-Ross model, which says that stage of dying, one of the most well-known models explaining reactions to terminal illnesses is proposed by Kubler-Ross. She identified 5 stages that individuals may go through when facing death. The first stage is denial, where the individual refuses to accept the reality of the illnesses, and this acts as a defense mechanism to reduce immediate shock. The second stage is anger, where the individual may feel frustration and ask, why me? Why is occurring to me? Is a question they'll get. This anger may be directed towards the family members, doctors, or even themselves. And the third stage is bargaining, where the individual attempts to negotiate for more time. This may involve making promises or turning to religious beliefs. And the fourth stage is depression, characterized by deep sadness, withdrawal, and sense of loss, can be observed in the patients. And in the final stage, that is acceptance, where the individual comes with to terms with the reality of death. At this stage, the person may feel calm and prepared. And it is important to note that these stages are not linear. The individual may move back and forth between them. Next, we are moving to coping with terminal illnesses. It involves managing emotions, social, and spiritual challenges. Emotional coping includes dealing with fear, sadness, and anxiety. Patients may use strategies such as talking to others, expressing feelings, or seeking counseling. And spiritual coping is also important. Many individuals turn to religion or spirituality to find meaning and comfort in their lives. And beliefs about life and death can provide a sense of peace and acceptance. And social support plays a crucial role in coping. Support from family, friends, and healthcare providers help patients feel less isolated and more secure. Open communication and emotional connections are essential for effective coping. Then the role of family and communication. Family members play a vital role in the care of terminally ill patients. They provide emotional support, assist in decision making, and help in daily care. However, caring for the terminally ill patient can also be stressful for families, leading to emotional and financial strains. And effective communication between patients and families and healthcare providers is essential. Communication should be honest, sensitive, and respectful of the patient wishes. So patients should be given the opportunity to express their feelings, fears, and preferences. And respecting patients' autonomy is very important in this stage. And patients should be involved in decision about their care, including treatment options and end of life preferences. Palliative care, hospice care, it is also known as. Palliative care is a key component in the treatment of terminal illnesses. It focuses on providing relief from pain and other symptoms, and improving quality of life, and supporting emotional and psychological well-being. And palliative care can be provided alongside medical treatment. Hospice care is a specialized form of care for terminally ill patients, usually providing in the final stage of life. It emphasizes comfort, dignity, and support for both patients and their families. There are also ethical issues associated with terminal illnesses, such as a right to die and patient autonomy. These issues require careful consideration of moral, legal, and cultural perspectives. And in summary and conclusion, terminal illness affect body and mind, emotional stages and natural emotional stages are natural, and support systems are essential, and goal is quality of life. So terminal illness is a complex experience that affects individuals physically, emotionally, socially, and spiritually. Understanding the psychological processes, coping mechanisms, and support systems involved helping in providing compassionate and effective care. The goal is not only to manage the illness but also to ensure dignity, comfort, and quality of life for the patient. So, by this, we have covered 7, 8, 9 units. Tomorrow, we'll discuss about the other 3 units. Okay, that is 10, 11, 12 units. Thank you, students, for patience listening.